Everyone loves going to see the dentist, right?
They have a lot. Can I see your teeth again, man? Just put your head right down in the middle. Okay, now can you brush your teeth for me? There we go.
Especially younger kids. Well, it probably depends. But paying attention to teeth and learning good habits at an early age can pay big dividends later on. On Saturday, January 20th, the Medical Reserve Corps of Southwest Vermont hosted a pop-up clinic at the park house of the Dana Thompson Recreation Park in Manchester to give some younger patients and their parents a chance to get an assessment of their teeth and some advice on how to keep them healthy, such as learning how to brush them. Several dentists from the area volunteered to come in and do the checking up. Wes Baker, a retired dentist from Bennington, was one of them.
Well, a lot of what we're trying to do here is, screen for dental disease for sure. But the big thing is the prevention, the education, nutrition, how that impacts not only their health, but the health of their teeth, making sure that they are brushing properly, flossing, the reason why, so it's not just, I'm doing it because mom said I had to. And the other part of that is, they make them aware of any problems that are developing so that they can hopefully deal with them before they become a real issue.
The Medical Reserve Corps Southwest Vermont was founded in 2002 and serves all of Bennington County. Martha Cornwell, the unit coordinator of the MRC, described what they were doing.
We're a group of mostly medical providers, some retired, some still practicing, and non-medical providers that are trying to work to fill medical gaps in the community, and we're trying to build kind of prepared, healthy, strong communities. And so we've done a lot of different things over the course of the last few years. You probably saw us when we were doing COVID clinics for the over 65 population. We did them all over Bennington County. We're here today doing an oral health pop-up clinic. This is our third pediatric clinic. We recognize that Bennington has really difficult time recruiting oral health providers, and the oral health providers that are here really do not have openings at the moment because they just have such large panels. And so this was one of our ways that we could step in to fill kind of a gap with children, especially because many of the dental providers here in Bennington County don't have room for pediatric patients. And so many patients are having to go up to Rutland or over into Albany or other areas to kind of get their dental care. And so Deanna Miravong, who works for the Department of Health and is actually the coordinator of our entire unit here in southwestern Vermont, and I had written a grant, an operational readiness grant through NACHO, and I could not tell you what NACHO stands for, but I'm sure Dee could. We are one of 8,000 Medical Reserve Corps units throughout the country. We formed after 9/11 to kind of be a response team that is already vetted. So if emergencies happen in any one of your communities, folks like us come out to help. And so we wrote a grant. We got a $10,000 grant. We're the only Medical Reserve Corps in the entire country that has started these dental clinics. And so we're working to create a model that we hope will be something that other MRCs can replicate in the future.
Tammy Mosier of the Straton Foundation was also on hand, spreading the word and hoping to bring down folks from the mountain towns.
Yeah, we were contacted and seen as really a great facilitator to reach the schools. So we put it out there to all the mountain schools, all of the Facebook community forums, shared with teachers and school nurses to try to just, create awareness and get as many kids down here as possible. Yeah, I think there's a lack of resources in the area for pediatric dental care and accepting Medicare or Medicaid. So, families, some have to drive long distances to go to a dental home. So we do as much as we can to bring dental into the schools. We have an in-school dental hygienist at Courier and Medowee, and we were just contacted by BBA to do some of their kids, and now Sunderland School. So, trying to reduce the barriers of transportation and kids miss school, they're in pain. We hear from teachers all the time and school nurses that kids are having trouble eating and smiling. And if they don't adapt that healthy behavior at a young age, then they get into high school and they're adults and have to deal with illness and extractions and everything else. So we're really trying to do as much as we can with education and prevention.
A shortage of dentists and dental hygienists in the area was frequently cited by several of the folks we talked with. Two of them at the clinic that morning were Julia Leonetti and Amy Meyer, who had some additional advice to offer.
So we'll do a little exam. We can check their home care because we have them brush with us. So we can let them know if they're missing any areas when they're brushing their teeth. We can do some nutritional counseling. So a lot of them have a high sugar diet, which of course leads to a lot of decay. And we have a big dental shortage right now. So Amy and I both work in the school districts as well. So we work with the children a lot in the southern part of Vermont. And we talk a lot about sugar. A lot of kids are constantly snacking, not necessarily sugary items, but things that stay around in their mouth for a long period of time. And it's drink choices a lot of times as well. Working in the schools, they see kids coming in with iced tea, Gatorade, which are very unhealthy choices for them to sip on all day long.
The clinic lasted for 4 hours and saw several drop-ins. So brush your teeth and try to stay away from overdoing it and the sugary stuff, which of course is easier said than done. For the GNAT-TV News Project, I'm Andrew McKeever.